Hi there, my name is Dr. Toby Haseler, and I'm a GP and the primary care post-COVID education champion for North Central London. Today, I'm just bringing you another brief presentation, our post-COVID education snippet. This is about the HealthWatch report entitled People's Experiences of Long COVID in North Central London. Key messages are: what is the HealthWatch report, where can you find it, and just a few key take-homes from it. So this is the report itself. It's produced by the 5 HealthWatch organisations from the 5 boroughs of NCL. It was a multi-method qualitative survey, interview focus group that was trying to identify gaps in people's experiences when they were suffering with long COVID. You can find it by simply searching for HealthWatch report long COVID NCL. And these are the top 3 links on Google, which all take you directly to the report itself. And it is very easy reading. It's a very well produced report. So straight on to the key messages. So key message 1 was about people's perceptions of how knowledgeable their GP or primary care provider was. And as you can see, most people felt they had a moderate knowledge, and a few had a perception of a great deal of knowledge, but a lot had an idea that GPs had little or no knowledge at all. And this probably has a lot of reasons, as I'm sure we're all aware, including the complexity of post-COVID and the difficulties of referring, which are hopefully being changed soon with the new single point of access. But it does give us perhaps a poignant reason to reflect on whether we need to just update ourselves, or hopefully these educational snippets can also be helpful in filling this potential knowledge gap. Key message 2 is that self-management techniques were by far the most effective management option for patients with long COVID. As you can see, 44%, which is higher than any other sort of specifically mentioned concept. And this comes hand in hand with the idea of making sure that we share these self-management techniques early, as well as raising awareness to patients of the kind of things which are out there, which might be able to help them. An example of that is the Your COVID Recovery website, which I've just screenshotted for you here. And again, you can find that very simply by Googling Your COVID Recovery, and it's the official NHS website. And it is a very easy to read, good resource for all sorts of patients with long COVID symptoms, be that immediately post acute infection or getting weeks or months into having long COVID itself. The final key message I want to just introduce is the idea of recognizing patients' symptoms and their impact. Now, this doesn't just mean recognizing the symptoms themselves and diagnosing condition, though there was a lot in this report about the large variety of symptoms, which aren't necessarily things we think about. For example, tinnitus, tingling, all over body pain were all symptoms cited by patients as being their long COVID symptoms, as well as a range of mental health challenges. It's also about the broad impact of those symptoms, though. So you can see difficulties in 62% of doing home chores. There's also about a quarter of people had difficulty with finances or caring or parenting responsibilities, which are obviously quite worrying when we think about the wider determinants of health. So that's my key messages. Obviously, if you do read the full report or even the abbreviated report, there are some other key messages in there, and it is interesting to read. It does give some points to think about. I hope you've found this presentation itself useful as well. Any feedback or comments are welcome, and thank you for watching.